and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Shivana Naidoo. She is a child psychiatrist. She wrote the Kevin MD article, PPE, Psychiatrist Presenting Emotion. Shivana, welcome to the show.
Thank you so much. Thanks for having me.
So we'll get into the article in a little bit, but first off, just share your story and journey to where you are today.
So my name is Shivana Naidoo. I'm a child and adult psychiatrist. I was born in Minnesota. My parents moved there from Guyana, which is where they immigrated from, a small country in South America. And then we moved to New York, where I spent most of my life. I did my training all in New York. And then after that, moved to Arizona for my first job. And I've been kind of back and forth, but just got a house and now are here in Arizona. I've basically been working in all aspects of outpatient mental health care. In training, we do inpatient, we do ER, we do consults. So as a part of our residency, we kind of have all facets of psychiatric background in us. Mm-hmm. But really, I've chosen to be a soldier of mental health care in the outpatient world. So I've worked for private practice, I've worked for hospitals in an outpatient setting, and now I work for a very large nonprofit. And my hope is that I can add to the hundreds of people working in mental health care to combat depression and anxiety. And my role at this point is really to educate people. I feel like my parents are teachers, and I think being a part of your podcast is one of those aspects of just really getting the word out there and how to get really good mental health care. So I've started a podcast called Thinking It Through with Dr. Naidoo, child psychiatrist, which you can find anywhere. And that's really to just give education about how to maneuver this complex world with insurance, without insurance, to really get the best mental health care for you and your child.
So you have a platform here on Kevin MD. So tell me, what are some of the main messages that you want to convey from your perspective?
Oh, so I think that the number one thing is that you have to find the right fit for you. And this is going to be a journey, right? It's not like just walking into a shop and Walmart and finding the product you want because everything is lined up. Really, it's like walking into Walmart and everything is all over the place and you gotta kind of look around and keep your eyes peeled. And that is unfortunate, but that is how the world is set up right now. But I do think that telehealth is going to really widen the option to have greater access to clinicians and therapists and physicians that really are able to provide help for you. But I think if you find your first fit with a doctor or a professional and it's not a good fit, that's okay. Keep trying, because we have to work on that alliance and finding a good fit for you to really help you in the best way possible. So I would stay encouraged, even if the first person you meet is not the best fit for you. I would remember that, you know, in a world where we want a quick fix, just like every chronic medical condition, diabetes, hypertension, cancer, it's a journey. So one pill may not fit all, one therapy may not fit all. We got to try and see, which is why I think that alliance is so important. And I think the last thing I would say is that it takes more than just one intervention to really help your healthcare. We need to be thinking not just about potentially medication or therapy, but also diet and exercise and relationships and mindset. So I think that COVID has really primed us to have these discussions. That's one of the positive things I think has come out of COVID, is to really bring mental health care and the need for that to the forefront and how we can chip away at that every day. And I think one of the benefits of social media and having our platforms online is that it makes it accessible and free to everyone. If we know where to look and persist in looking, we can find those tools.
Now, especially in my area, it's very difficult to find outpatient behavioral health. So for those patients who may be listening to this, do you have any tips and tricks on how to find a outpatient behavioral health clinician?
Yeah, so I have a podcast episode on Thinking It Through with Dr. Naidoo called Connecting to Care, and that entire episode is about connecting to care. First thing you can always do is go through your insurance company on the back of your card. You can call the card and they should be able to give you 3 people that take your insurance, which is the most prohibitive thing, right? Being able to pay for care. So 3 people that can take your service and be within a certain vicinity, geographic vicinity. There are lots of online opportunities that you can also find by looking at your local websites. I also think that another option would be any academic health center that you're close to, because academic healthcare centers have residents, and residents are in training and they care and they want to do a good job. And they have great referral sources. And academic centers tend to be associated with an ER and pediatrics, So as you know, as an ER doc, you are the kind of gatekeepers for everything. So I think if you have a good ER, an academic center, those are good ways to kind of be able to get your buy-in into a good mental health professional. And I think online also, there are lots of great new platforms that are set up to be able to meet care where you're at in your own home. So I would continue to look through those resources.
All right, let's transition into your Kevin MD article. It was published back in April. It's titled PPE, Psychiatrist Presenting Emotion. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Sure. So as a psychiatrist, wearing a mask is seeing patients in person over the past 2 years. I've kind of thought a lot about the symbolism of what that means and how to express that. And for those who are not connected to mental health care, anyone who trains to be a mental health care professional, whether it's a psychiatrist, a psychologist, a social worker, or a therapist of any level, you're kind of trained to be able to keep this poker face, basically like a mask, right? So that whatever the patient brings to you, they can continue to bring to you without having your reaction influence what they share or feel judged. And that takes some time to develop. And for me, that was really hard because I feel all the feels, right? So once I developed that poker face, it was interesting to develop having to wear a mask and then being able to kind of share more of my authentic self. So this article is really reflecting on the nuances of what it means to reflect your authentic self while being a psychiatrist, because so much of our training is to kind of hold yourself in so that people can be themselves by holding yourself in. And I think that that kind of dovetails into a little bit of analogy between being a physician and sharing yourself on social media, because I think that that also kind of puts yourself out there, but you want to be able to put yourself out there in a way that's authentic to you, but also protects your privacy. You want to cultivate a brand, but also be authentic to who you are as a person. So I think that the mask has really been a great analogy to understand, who do we really want to be? Who do we really want to show? And what do we want our patients to get from us? And I think mental health care is really changing because social media has put so many mental health care professionals out there, and people want to choose people they like, right? They want to get a read of you before they see you and start talking to you. So I think that that's something that's really changed compared to when I started my training, because when I trained, we really didn't put anything out there. But now I think you have to, if you want to be something and go somewhere and share your message.
Now, what kind of tips and advice do you have? Because most physicians, when they're trained to be proverbially stoic. And how can one put themselves out there? How can one be authentic, especially on social media or even the exam room? What kind of tips do you have for the clinicians to be their authentic selves while straddling that line of professionalism?
So it's challenging, I think, and I feel like I still am working through that. But I think that it's important to share compassion and genuine emotion. I think that compared to my training, where nothing should shock you, I think that when you are shocked, when you do hear a story that touches you, I think holding their hand and saying, "Oh my God, I can't believe you got through this. You're incredible." Just sharing your true feelings in a supportive way, I think really goes a long way with developing that alliance with the patient, having them trust you. I think online, it's been a challenge. I'm still learning. And I think that it's great to have role models like you who are doing it and doing a great job. But I think being aware that whatever you put out there cannot come back is important. Being aware that whatever you put out there is going to be a reflection of you and you don't know to whom. And being aware that we are an agent of change and positivity or negativity. So I think as physicians, as healers, as leaders, I think remembering to put yourself out there in a way that continues to foster growth and development and healing is something we should always remember.
Now, do you have a case study or an example of a success story where a clinician authentically put themselves out there and to take that in any direction you want? And how did that positively affect their practice?
So off the top of my head, I'm not entirely sure. However, I do listen to SiriusXM and I listen to Dr. Radio. And on Dr. Radio, I have heard several doctors on that version of radio. It's not quite podcasting, but they share a lot of their intimate stories about being physicians and how it touches people's lives. There's a particular portion called Vital Signs where they talk about themselves being patients as doctors and how that has helped them be a better doctor, because they've learned from being a patient what that is like. I think there are several stories of mental health professionals who have put themselves out there, having dealt with suicide, having dealt with depression and anxiety, having dealt with schizophrenia, and walking through that and becoming leaders in the field to be able to help others to get compassionate care and to give the best care possible. So I think that those of us, every doctor can become a patient. And there's a saying as a trainee in New York, our PsychR is called a CPAP, or a comprehensive psychiatric evaluation program. So we would all say we're all 1 foot in the CPAP. All of us could become mentally unstable given the stressors, given a certain kind of amount and threshold of stressors. So I think having that compassion and knowing that we could all kind of be in a position to need help helps us to see ourselves in our patients and help the patients see that we care about them. And that's really what it is. It's having the patient see that we genuinely care about them despite the busy world that we have, and to see that we want to do our best and that we're going to try whatever way we can to do that.
We're talking to Shivana Naidoo. She is a child psychiatrist. She wrote the Kevin MD article, PPE, Psychiatrist Presenting Emotion. Shivana, over the past few weeks, there have been some tragic mass shootings across our country. And I'm interested in hearing your thoughts about that from the perspective of a child psychiatrist.
So, as a child psychiatrist, it's been a really challenging few weeks as a child psychiatrist and a parent. I also did another podcast episode on this recently in my response to the Robb Elementary School shooting, because it's made me look at my patients a little bit differently and my kids a little differently, because when this happened, it was the tail end of the school year for my children. So it happened on a Tuesday, but I still had to send my kids to school on Wednesday and Thursday. And I think I, like many, many parents, really struggled with doing that. And I know for the East Coast, they're still doing that. They have another month of school left. But I think for my patients, I see so many kids, and I see a lot of these adolescent males that are now being kind of represented as a group to watch and look for. And I think that for a lot of these young men, we need to work harder at helping support them earlier on and helping them feel connected, not just to care, but to each other, to society, to friends, to school, to themselves. And I think this goes back to authenticity. I think that for a lot of our young people that are growing up in the era of social media and putting not your authentic self out there, putting something else out there to get the likes or to get approval or to get attention, there's a disconnect developing between who young people really are and feeling on the inside and what they put out there. And I think that disconnect further isolates young people, which is what helps us know that we need to help in-person contact kind of restart despite COVID, despite telehealth and its technology. We still need to have people holding hands and hugging and having face-to-face conversations. And I think that it's, in my podcast episode, I spoke about my expertise in assessing for suicide. And, my suicide assessment and questioning can take a good 30 minutes, get a good handle on what those thoughts are and really help them think this through and think forward. But for homicidal ideation, we still have work to do. It is so, so rare that people that present for mental illness have homicidal thoughts. It does happen, but it's rare. And I think that having these shootings persist makes me, as a psychiatrist for teenagers and teenage young men in particular, be much more conscientious about spending the time to assess for those as well, and really trying to work at connecting young people to care and helping them feel valued. And again, going back to that interaction between me and a young person, them feeling connected to me, right? Them feeling that I'm listening to them, I'm validating their concerns, that I'm here for them is really important. And I think the idea that we are going to continue to work with them and follow them, even if they're not ready. So many of these I'm going to say young boys in particular, that cause me some pause, don't readily open up. I have my 60-minute assessment, and then I have another 30 minutes or 15 minutes. And sometimes we have to sit in silence, but I'm making small interventions, small statements, kind of trying to bring them out of their shell and trying to tell them things to let them know that I want to hear your story. I want to hear what you have to say, and I value you in your life now. That's kind of part of the power, I think, of being a mental health care professional, knowing that we have that ability to kind of reach in and give that inner hug that they need if they'll let us. And if not, continue to see them until they will. But a lot has to change with mental health care. We have a really broken system, And it's been really frustrating for me as a psychiatrist working in community mental health care and seeing all of the gaps that we still have. Despite all of the resources that I have at my fingertips, I still feel like we can do more and need to do more in terms of mental health care. And I think also dispelling the myth, right, that school shooters all have mental health care issues. That may or may not be true, you know, and I think the vast majority of mental health care patients do not have violent tendencies, do not hurt people. And knowing that it's more than mental health care that needs to be fixed to solve this problem. There are societal levels, political levels we need to involve that not just involve gun regulation, but also involve families and restructuring families, having families spend more time with their children, having schools be more cautious and aware, and educating our children about what they can do to get help for themselves and for their peers if they need it.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
So I think the take-home message for me would be that there is mental health care out there. It's hard to get, but we're there. There are good psychiatrists like me and good professionals that want to help your child and help your family. Keep looking for us. I would also say that anytime you feel that your child might be in crisis, please call the hotlines. Please let us know. Please don't ignore the warning signs for your child needing help. It's always a good idea to have one of us take a look at your child beforehand versus wait until they're too far gone. So we want to avoid hospitalizations. We want to avoid crises. So be proactive and look out for us. You can always start with your schools. You can always start with your family, with a therapist first, and then come reach out to the level of psychiatrist if you need to. And in terms of responding back to my article about PPE, I think as a young psychiatrist, if anyone is out there, young psychiatrists, young professionals, knowing that the mask we have developed to become this professional can be lifted and that you can become your authentic self and share a little bit of that to really build that alliance with patients. And then I think that they will appreciate that and need that, especially in these times.
Shivana, thank you so much for sharing your time and insight. Thanks again for being on the show.
Thank you so much, Kevin.